Hello, this final project, ROCKET EMR 3.0, is a project for our Informatics Fall 2021 class. It's going to be presented by Zasha Cantu, Antonia Trejo, Gabriela Arriaga, Miracle Creighton, Tyresha Blaylock, and Lillian Tren. Table of contents: the perfect EMR, safety, efficiency, and financial impacts. Chapter 2, about our patient, Mr. Jones. Chapter 3, medication reconciliation, the definition and its importance. Chapter 4, swim lanes, team involved in Mr. Jones's care. And lastly, Chapter 5, EMR improvements and proposal of redesign. Case timeline and flow diagram. Phases 1, 2, 3, 4, and 5 are as follows. Phase 1, complete the list of current medications, over-the-counter, prescribed herbs from our patients. Phase 2, formulate potential medication prescription lists. Phase 3, compare and contrast the new and original medication list. Phase 4, consultations with healthcare team to make collaborative and clinical decisions of selected medications to continue or perhaps discontinue. Phase 5, educate final medication lists to the patient and family, and of course, the care team.
So in this section, we will discuss the perfect EMR and talk about safety, efficiency, and its financial impacts. To begin, let's start with safety. One of the biggest concerns when it comes to using the EMR is being sure to maintain patient safety, privacy, and security. It's important to educate and train staff on how to use the EMR and how to monitor and be mindful of things that could cause a threat to the database. When it comes to utilizing new tech, we must also make sure everyone who will be using it has been properly educated on it and how to use it. Staff should be informed and educated on negligence and the importance of logging out of systems that are left unattended. And with training, we also want to educate them on the importance of phishing and how to check and report any suspicious emails to IT or either their nursing advisor. Another thing that is important when talking about safety is risk analysis. When dealing with sensitive information, we must always monitor risk analysis to determine where patient information is stored and to help determine which applications should be monitored. Risk analysis or management should be conducted annually and when any major changes in systems occur. The next important safety feature is login authentication. End users should be able to use their ID badges or some form of biometrics like fingerprinting or a strong password in order to have access to a patient's information. When left unattended, there will be an automatic log off after 3 to 5 minutes of inactivity so that we are able to maintain security and privacy of the patient. No one other than a team member assigned to the care of that patient should have access to patient's information in order to prevent mishandling and maintaining confidentiality. Time is also important in patient safety. We want healthcare workers to be able to work with a simplified database so that we are able to chart and document, but also have time to provide the best care to our patients without jeopardizing patient security. Lastly, when it comes to introducing a new system, making it error-proof and fail-proof can be a little tricky. In order to make sure we are keeping the patients safe, we as nurses can make sure to always verify all data in medications, take our time in putting that information and documenting any changes of assessment and asking other nurses to help verify certain medications. On this slide, we'll talk about efficiency. In order for healthcare workers to get the most out of their EMR, it is important to provide the staff members on the unit with training on how to effectively use the system. As mentioned on the previous slide, safety is the main priority when it comes to taking care of patients. The usability of the EMR would make documenting patient information easier as it would be less time consuming and allow for patient information to be shared easily among other authorized healthcare workers on the patient's team. EMRs allow staff members to be more hands-on with our patients and to relay information and any changes of their status more efficiently to other team members. It helps with collaboration and keeping everyone updated on all changes. The interoperability of EMRs could help in coordination of healthcare services among different specialties, and non-affiliated healthcare providers. In the ICU, interoperability provides the added benefit of communicating user actions associated with infusions back to the EMR. In order to be more efficient on the ICU, and decrease the amount of disruptions and workflow, the EMR needs to be nurse-friendly and easy to navigate. Most nurses, more specifically older nurses, are not big on change in the use of technology. So making sure the system is easy to use and navigate is a big deal. Also, comfort. We want to make sure every nurse is comfortable with using software and offer training. The EMRs will provide key information common on all intensive care units. The EMRs in the ICU are helpful because they remind us when patients are due for upcoming medications and prevent medication errors from happening by using the 6 rights as far as right patient, right dose, right time, and so forth.
Now we will talk about our EMR and the financial impact. This graph is comparing our EMR, which is MAC and other popular EMR systems that hospitals and clinics use. Research shows that Epic EMR will cost $1,200 for self-hosted solutions, $500,000 for large hospitals and clinics, and they do not offer a free trial. eClinicWorks is $449 monthly, $559 with a practice management, and no free trial. Care Cloud is $349 monthly, $349 plus for additional add-ons for the EMR, and also no free trial available. After doing research for a Mac Practice EMR, our estimated price would be $1,500 for a 6-month contract, $2,000 for a long-term contract, and we will offer complimentary and integrated software and solutions. Here I will talk about our Mac EMR software. Some pros include software compatible with all Apple devices, Mac native options which are designed exclusively for the Mac operating system, cloud or web-based software options that run optimally on Apple devices with access to the internet, more flexible, less tech problems, and a cheaper outlay. Apple dominates the digital device and computer market in the US today, so it is no surprise that many providers are specifically looking for the EMR software vendor to support Mac operating systems. Mac Practice medical software gives doctors access to exceptional software at a reasonable cost. Mac Practice backs this up with a full spectrum of complementary and integrated software and hardware solutions with best-of-class support not found with any other practice management or clinical software. Our EMR system will be a reasonable price. We will have no reason to compromise patient safety in order to save money.
About the patient. Section 2. Mr. Jones. Patient medical history. Name Mr. Jones, gender male, allergies bananas, profession officer, surgeries, elective thromboectomy, congestive heart failure, complications led to readmission. During the interview phase, it is crucial to obtain patient information, review medications, past medical history, procedures, and allergies with patients to ensure that you have the correct information in the EMR. Acronyms such as OPQRST, sample, and SBAR can gear the nurse towards an appropriate interview to ensure that all bases are met. OPQRST stands for onset, provocation, quality, radiation, severity, and time. Sample stands for sign or symptoms, allergies, medications, past medical history, last oral intake, and events leading up to the reason why they're in the hospital. And then SBAR is situation, background, assessment, and recommendation. An example question could be, Mr. Jones, when was the last time you had a meal or something to drink?
Next up, we have medication reconciliation, the definition and importance. What is it? It is the process of identifying the most accurate list of all medication that the patient is taking, including the name, the dosage, frequency, and the route. This is very important because we don't want any medication errors or any drug interaction or incorrect dosing, because this can be very harmful to the patient. It is also important to ensure that new medication is compatible with other medication. And lastly, this ensures safety checks and promotes patient safety.
Identifying information, admission and transfer medication. Upon admission of all patients, a thorough medication list is crucial in tailoring the care of each patient. The nurse must document the medication, the dose, the time, the route, the frequency, and reason each medication is taken. Once the patient is ready for transfer to another hospital, floor, or back home, a list of medication given and discontinued must be documented. Nurses must be aware of any possible medication interactions that could harm the patient. For example, if a patient has a history of taking Viagra for erectile dysfunction, this must be thoroughly documented because nitroglycerin can have an adverse effect on the patient, causing a drastic drop in the patient's blood pressure that could be harmful for the patient.
Identifying information, discharge medication reconciliation. For medication reconciliation at discharge, this is of most importance because we must ensure that our patient knows what medications will be going home with them, the doses that are required for them to take, and certainly last but not least by far is the possible adverse reactions to the medications that they will be consuming. One of the methods that we can use to ensure that our patients understand the medication that they are going to be taking at home now is the teach back method. We can ask the patient to just let us know, how do you understand that you're supposed to take this medication? What do you think you need to look out for? Just so we know that they are 100% informed to all of the possible adverse reactions and doses that should be taken. Written instructions. We all know that at discharge, it's a very overwhelming moment. You're ready to go home. You're tired of being there. And just being able to provide our patients written instructions, what they're going to go home with in regards to medications or even instruments, how they need to take their medications, when they need to take their medications in writing is of tremendous help. Another thing that we can do is if we know that they have support systems that they're going to be going home with or to, we can have them in on the discharge medication reconciliation, asking them if they have any questions or concerns or if need to clear anything up again. And that's in regards to having support for our patients being family members.
Now let us discuss what could have been performed better in Mr. Jones' care through a swim lane depiction. Throughout Mr. Jones' stay, the roles involved in Mr. Jones' care are seen in the illustrated swim lanes, including the patient, nurse, doctor, and pharmacy. The nurse first compiles information and presents the medication list. The nurse would then document medication in the patient's chart, and the doctor would utilize this list to determine what other medication prescription the patient should take. Then the doctor will record the new medication in order. Next, the pharmacy will review and analyze this order and ensure no complication or errors for this order. To put in perspective, when Mr. Jones was admitted to the ER unit, the admitting nurse should complete medication reconciliation. The first initial stage of medication reconciliation is crucial because the patient is interviewed regarding home medication, such as over-the-counter medication or herbal medication that the patient is taking. If the patient does not accurately communicate what he or she is taking, this can potentially harm him or her. After the nurse obtains this list, the nurse will converse with the rest of the healthcare team under Mr. Jones' care. The doctor and the pharmacy will extrapolate what specific medication to arrange for the patient. The healthcare team should also consider if Mr. Jones has any prior admissions. As Mr. Jones is transferred to the operating room, the nurse caring for Mr. Jones should reevaluate and add to the medication reconciliation. The nurse should discuss all medication for the patient with the doctor, the pharmacy, and also the anesthesiologist so that everyone overseeing Mr. Jones is on the same and exact same page. In fact, communication is key. We must confirm the team has all the exact appropriate information. This transfer of communication provides that we have the right medication reconciliation because if something was given during surgery and the doctor was not aware of it, this can cause life-threatening conditions for the patient. This would not be good at all. When Mr. Jones is transferred to the ICU, the whole medication reconciliation procedure should be repeated. After the patient comes back from surgery, observing for any kinds of infection is crucial to recuperation. The nurse needs to be aware of the medication given during surgery and even after PACU so that the healthcare team knows that the medication that the patient has and is taking. This is essential to monitor the medication reconciliation because sepsis is very typical after surgery. As a result, knowing which antibiotics and medications are given during surgery will benefit the team to stay organized, accomplish optimal patient safety, and lastly, therapeutic care. Here's the discharge swim lane. When Mr. Jones was transferred to the med-surg unit, the medication reconciliation form is required to be repeated. Before discharge, the nurse, doctor, pharmacist should reevaluate all the home meds. Discharge is the last time to confirm that every team member is on the same page and accurate medication and dosing are completed. If all the parts have been done correctly, Mr. Jones will have no difficulty proceeding home with the medication. Medication reconciliation is important because it prevents harm from medications, adverse drug interaction events. This is the top priority for patient safety. We must also implement this in all transitions in care, at admissions, transfer, and discharge. This is an effective strategy for preventing adverse harm.
EMR improvement, the proposal of redesign. Some of the components and improvements that my group and I came up with would be improvement number 1. Provide fast and efficient records for medical professionals worldwide. Number 2, prescription status and retrieval to be accessible as soon as possible despite system outages. Number 3, comprehensive healthcare records that are to be accessible to both patient and healthcare professionals for collaboration at any time. Improvement 4, secure portal processing data to avoid any breaches. And improvement 5 would be paperless records that would allow for a decrease in paperwork and less room for HIPAA violations. To elaborate on improvement number 1, which is it provide fast and efficient records for medical professionals worldwide. We believe that if a patient is allergic to a specific medication, for example, it would be ideal for medical professionals to have a fast and efficient way of accessing this data in order to prevent any life or death situations. In regards to our ICU patient who is allergic to penicillin and bananas, it would be ideal for us to prevent administration of that antibiotic. Another example would be provides legitimate data of the patient, such as previous medical concerns, current medications, labs, and or surgeries. So in our case, our patient has undergone elective thrombectomy. It's important for our medical professionals and nurses and PCAs or anybody handling a specific patient to understand and know what our patient has undergone before being admitted to our specific unit. Another point would be that it allows for the ability to communicate with other healthcare professionals, such as referrals and outside hospitals. So to elaborate on this, it would be that if a patient who is getting organ donation came from another state, for example, Arizona, and we need to know exactly what happened, any complications, any downfalls that occurred during surgery. This would be ideal for us to have communication within that facility, not just within our hospital system. So our database would allow for communication. Another point would be provides and assures a higher quality of life for the patient. So this ties into a sense of stability and communication, which is key to any healthcare system or just any communication in general. The last thing that would cover the improvement number 1 would be precise and clear data that is inputted into the EHR for others to view that are also taking care of the patient, such as RNs, RTs, PAs, MDs, PCAs, etc. So this is an important aspect to understand because it allows for each healthcare professional to follow specific protocols and have a clear understanding of what's going on to avoid any confusion or any accidental medical conditions. To elaborate on improvement number 2, which is prescription status and retrieval to be accessed as soon as possible despite system outages, this allows the prevention of files from being lost or unclear. Although everyone is human and may input a wrong medication, it is important for a medication prescribed to be eligible. When it is portrayed on the screen, it is not written by hand, which allows for one to be able to read the screen much easily and not misunderstand what medication is needed to be administered. Another point is that this allows for whoever is administering medications to have reassurance that the medication was actually prescribed by the patient's doctor and not a handwritten prescription that can be forged. Having a fully loaded Pyxis is also an important aspect to understand. For example, in an ICU, it is essential to have the Pyxis loaded with opioids, muscle relaxers, CPR medications, because these are the most used medications on the floor depending on which specialty, whether it be in ICU, PICU, it just depends. This point also allows for prescriptions to be safe and reliable overall because it allows for the times of administration to be documented. So for example, if it wasn't documented, then it didn't happen. If a nurse administers an opioid and forgets to document it, this could cost her job by showing that it got checked out or patient use. But if she or he does not document, then they actually gave it, then it could be said that they personally took it, or that they could cause the next shift nurse to be unsure if it was administered and could cause the patient to remain in pain until they can pinpoint the medication time or date that it was administered. Another aspect to this improvement is that we understand that there could be various times where system outages are going to occur, such as a few months ago when we endured a winter storm. It's essential to make sure we have a system that is running and able to be updated 24/7 hours of the day, because there's no way for us to stop a life or death situation, such as someone going into cardiac arrest. We don't have time to waste at that moment. So it's essential to make sure and understand that the system that we are creating will not allow for system outages to occur during these times. To emphasize an improvement number 3, which is comprehensive healthcare records that are accessible to both patient and healthcare professionals for collaboration at any time of the day. For example, if a patient is traveling from out of state or country to MD Anderson Cancer Center, they should be able to have daily check-ins with their doctor without having to travel all the way over to Texas. A lot of times these patients simply come for their chemo treatments or yearly checkups, which is essential to travel for. Although when they have their monthly check-ins, I feel like it's important to understand that offering a system that allows for virtual meetings would be beneficial. Another aspect would be allowing for the patient to access their medical records without having to drive all the way to the hospital. So this would go back to the case of our patients who travel from a different state or different country. When a patient comes from another hospital, it's essential for them to have access to all of these medical records in a click of a button. Our system would allow for them to access anything such as prescriptions, previous surgeries, diagnoses, and referrals, or anything else they would like to have access, all by having their own personal portal. Another aspect would be allowing patients to have virtual appointments online if available, so that they are not having to physically meet in a doctor's office unless indicated by their doctor. This would be very important for those who are immunocompromised and living in our daily society as we are enduring a pandemic. To elaborate on improvement number 4 is secure portal processing data to avoid any breaches. This would create reassurance for both patient and physician information and discussion. Another aspect would be allow for audits to not occur and prevent the hospital with dealing any legal encounters. This would elaborate that if a patient's file was lying around on the nurse's station and another person who shouldn't have access to this patient's file gets access, it would allow for any HIPAA regulations to not be violated. Another aspect would be that it would allow for electronic signatures to be provided after charting data is inputted into the system, to have a track of who provided a certain service for a patient. And lastly, improvement number 5, which is paperless records that allows for a decrease in paperwork and less room for HIPAA violations. To elaborate on the key points on this improvement, it would allow for records to not get lost in translation and prevents anyone who should not have access from obtaining private information. It ensures that documentation took place and has no room for error or miscommunication to occur. HIPAA violations are prevented because permission is required in order to assess an EHR and the PICSs for medications, and it allows for medical records to be accessed and updated periodically. So example, if a patient's file was laying around on a unit, again, if a random person was on the unit visiting a patient that was not supposed to be up there and made their way up there and grabbed the patient's information, this would be a HIPAA violation that would be prevented if we were to be using our database and not paper. We'll elaborate on our proposal for our name, which is ROCKET EMR 3.0. Our motto is ROCKET EMR 3.0 is a platform that ensures safety, efficiency, and minimal financial impacts on the healthcare system. This program provides the following innovations. 1, 2, 3, 4, and 5 are the previous innovations that I listed in the previous slides and explained. Next is the sample EMR. So this is the ROCKET EMR 3.0 main page. So this is exactly how it would look when a nurse or provider would log in. It has the ability for you to select the patients, have all of the information such as admission date, code status, allergies, a communication chat box, patient history, team, any type of vitals that the patient has during check-in. Our next slide is going to be showing all of our references that we use in order to complete this project. And lastly, I would like to conclude in behalf of my team members, Antonia, Gabriella, Miracle, Tyresha, Lillian, and me, Zasha. Thank you so much for your attention and for listening to our presentation. Thank you.